everyone. Welcome back. We are so happy to be with you today with Hope Health Communication. So, we're two Black moms, researchers, and hope seekers. We come together to bring you real talk, trusted resources, and community wisdom.
Yes, and we know that raising a family takes a village, and we're here to be a part of yours, sharing hopeful messages, expert insights, and tools you need for your family's wellness, growth, and joy. So, today on our podcast, we have our guest, Debbie Brown Harris, who is a part of our community wisdom and an expert in doula. And we're excited to have her. And so, hi, Debbie.
Hi,
Hello,
Debbie.
everyone. Hi.
Welcome, welcome.
Thank you. Thank you for
So,
having
tell
me.
us about yourself and the work that you're doing around Black maternal health.
Yes, my name is Debbie Brown Harris, and I am a mother. I am a wife. I am an author. Um, I am a full spectrum doula, and I also have a nursing background. Um, I definitely dived into this doula thing from actually becoming a mother myself. Um, and it kind of shook me in a way that nothing could ever, like, I had to experience it myself to actually see that, wow, this is really what's going on um, in America. Um,
Mm.
I really wanted to be a nurse for as long as I could remember because my mom was a nurse. I wanted to follow in her footsteps. I remember her working night shift.
Mhm.
And she was a CNA, and I just remember her with the scrubs on, looking so cute with the stethoscope. And
Looking
I
all
just remember,
professional.
yeah, like I just remember that, and I just wanted to follow in her footsteps, and I knew I wanted to do something that dealt with like taking care of individuals. And a lot of things shifted when I was in nursing school. I became I became pregnant, and I was not. I wasn't married. I was a single parent at the time, and I was trying to finish nursing school. I saw the I saw the effects that it had on me as a single Black woman being pregnant, um, and in my status with not really having the higher education, right? Not really knowing what it takes to be a mom. I saw my mom, but I didn't know what it really was like until I was with a child. Like, what are these feelings I'm feeling? I didn't know the right questions to ask when I was at the doctor's office. I was just
Mhm.
listening to what I was being told, going with
Mhm.
emotions, right? I was also experiencing at the same time some spiritual struggles, relationship struggles,
Mhm.
emotional struggles, career struggles. I mean, all of this trying to work at the same time. And I wanted to make my mom proud. And, she was telling me, I need you to just finish school. I need you to do this. But I was struggling because while I was in school, I was able to actually work as a nurse technician. And it was in that instance that I saw some disparities. Uh,
Mm.
and I was torn because I said, I don't think I want to do this anymore. Uh,
Mm.
this is not what it should be about. I saw a lot of unfair treatment um,
Mhm.
based off the color of your skin, based off of um, socioeconomic status. Um, and it was hurtful. And I was like, this is not truth. This is not safe. This is not a safe space. I wrestled with it and I decided to pivot and still dive into my nursing education, but I decided to pivot, which was a huge pivot. um,
Mhm.
but it was something that I needed to do. I just had to be true to myself. And
Mm.
when it really hit me when I actually was given birth. And after I gave birth, my world rocked. Um, it it shifted. I was a mom now. Um,
Mhm.
the support that I wanted from my partner wasn't really there like I wanted it to be. The support from a spiritual standpoint wasn't really there. Um, I had a lot of shame, but also at the same time, I noticed I wasn't getting the support from the medical community.
Mhm.
I had issues with breastfeeding, and
Mhm.
I wasn't told. to seek a lactation consultant. I wasn't told to, look into a nursing bank, a breastfeeding bank. None of these things were told to me. I had to find this out on my own. And, I was told to go to the WIC office, go to the WIC office. I wasn't told that let's check his cleft, let's check to see if he's not sucking, none of that. I was in deep postpartum depression. I wasn't told to seek therapy, counsel. I didn't even know I was in postpartum depression. I didn't know that that's what I was in until later, right? But now looking back, I was in some deep postpartum depression. But all these things to say that I did not have any resources. I didn't have any community. I didn't have the support of the medical community. I was on an island by myself. And that's what I felt like. And as much as my family could possibly be there for me, they were still trying to figure things out at the same time. And even my mom, she always says, I'm just doing what I know, and she herself didn't know much because of her growing up and her situation, but she was doing the best as a mother. So she was just telling me and giving me what she knew, right? Information, but it wasn't enough for me. And it led me down a path of really finding out what is wrong. Why are we being ignored? Why do I feel alone at one of the most important, pivotal points of my life?
Yeah.
That's supposed to be a beautiful experience. And I can say, like, my first experience of being a mother wasn't that enjoyable.
Wow, that's powerful. Just that statement.
I'm just going to be real. It was very sad for me. It was very sad, as much as I wanted it to be that story.
Of course.
Of, man, it was the best time I had.
Oh, yeah.
And that's when I decided to look into helping women who were seeking community of other women who were like me. I joined a support group. I didn't even know about the doula thing. I mean, I've heard about midwives and everything, but nobody was talking about doula, right, at this time. Like, this was like 21 years ago. Like, it, no one was really talking about it as far as I know. But it's been around for years. I mean, birth workers have been around for years. And
right.
I decided to get some deep training, and I started training with Donor International, and I trained as a birth doula, a postpartum doula. I also trained as a bereavement doula. I did a bereavement doula because I too suffered loss, which I never really talk about, but I did suffer a loss. And I noticed in the birthing community, a lot of people categorize losses, and a loss is a loss.
Right.
That's right.
A loss is a loss. And when I finished my training, I intentionally put myself at Planned Parenthood and volunteered for those women who were experiencing their form of loss. And it was the most empowering, weeping moment of my lives. These women's spirits were such in a dark place of trauma that the decisions that they were making, or their health choices, or the outcome of their pregnancies, it put them in that standpoint because of lack of community, because of systemic racism, because of socioeconomic status, because of discrimination, because of microaggression. And I was just listening to their voice. They just needed to be heard, but more than anything, they needed to feel loved. And that's when I decided to name my business Unconditional Love. Because I too wanted to just be loved unconditionally, no matter what I looked like, no matter what my status was in. I wanted my child to be loved. So that's kind of where it took me. And then I decided to do adoption doula because I just saw so many ways of you being a woman and being a
Right.
mother. It did not come through the birthing experience, right? There's a lot of
Mhm.
people who struggle with fertility issues, and um, they cannot, their uterus is just not healthy enough on their and to do that, to carry. And I had the opportunity to really um, work for a woman, and she has a great organization now. I don't know if you guys ever heard of her organization, but it's called Help Us Adopt.
Mhm.
Very well known. And she is not a woman of color, but she gave me the experience to help her throughout her adoption process. And it really brought another layer of doula work, of community work. And my focus now more is so on women who are in less of a socioeconomic status. I really tend to gravitate towards them more, uh, because I believe that everyone should receive access to quality health care during pregnancy, childbirth, and postpartum, no matter if you don't have money or not. Like, it should be a no-brainer, because ultimately we we are parenting a nation.
Mhm.
Our wombs birth nations and
Mm.
generations. And if we are not taken care of, even before pregnancy, during the fertility stage, um, it can really cause a cascade of effects that will affect generations and generations and generations. I always think about um, my mom saying she would always sing to us when we were in the womb. And I remember being little and always hearing her sing to us. And it's so important when women think about, conceiving or being a mother. Maybe you don't want to conceive. Maybe you just want to, mother through
Mm.
adoption, or be a big auntie and mother that way. We're
Mhm.
mothering in all different ways, okay?
Mhm.
But it's important that you know that you're feeding a child. Like, they're learning everything from you. They're picking up your energy. They're picking up everything you're bringing, and that dictates literally what that child will blossom into, and the
Mhm.
generations will blossom into. So, um, my focus right now is more so on postpartum care. I do births once in a while. I just did one a week ago. But because I have little ones, it's really hard for me to really
Be on call.
you know, to do that. So I kind of pivot more into postpartum care and nutrition
Mhm.
and spiritual health. And
Mm.
um, spiritual health, I see as a very important a factor when it comes to uh, your mental health, because
Mhm.
our body is all connected. You have your physical, you have your soul, you have your spirit, you have your mental, and um, they're all like pieces to the puzzle. But I noticed that a lot of women are yearning for a spiritual connection, whatever that may be. Meditation, prayer. They're yearning for that, but also yearning for the mental aspect as well. And we do care about the baby. That's important. But the mother, no one's asking what the mother needs. And I've noticed that with my postpartum care. If the mother is not nurtured, if the mother is not cared for, if the village is not there to support her, the baby will eventually suffer. And maybe not now, but later on, the effects of that, because statistically, I have read, and it is not, and this is mind blowing to me, that is not necessarily the presence of a father that dictates the emotional intelligence and happiness of a child. It's the mother's happiness.
Mhm.
Mhm.
Tell you, it is true,
Mhm.
because I lived
Mhm. Mm.
it and I've seen it.
Mhm.
I've seen it. I'm still in it, kind of, and I don't want to get too much into it, only because to protect, my son. But you know, you can have a father not be around, right? You can have that absentee, but if the mother's happiness is there still,
Mm.
nurturing aspect of it is there from the mother. Her well-being is on point. She has community. The child will thrive.
Mm.
Mm, amazing. Deb, you said so many
I'm
things.
sorry.
No,
Yeah,
no,
this is
don't
a good thing. This is
apologize.
a good thing.
No,
And
I was
I
taking
know our
notes.
listeners are like
Mhm.
just mind blown at probably relating
Mhm.
because as I was listening to you, I'm like, you are sharing a representation that so many women, mothers that can relate to, right? So
Mhm.
not even from the health practitioners space, which we should definitely talk about that role, but you as a mom and how you became a doula and why you became a doula.
Mhm.
One of the things that really stood out to me out of there's so many things, but one of the things I want to go back to is the kind of person you are to in your pain looking at a solution and saying, I went through this, I don't want anybody else to go through this, and so how can I learn and how can I pivot to become this this health practitioner on the community side to help Black women that may have a similar path that I had. And that is a beautiful thing because not a lot of people can do that. I don't think a lot of people are able to choose, um, to be a part of the solution. And we know right now the state of Black maternal health, the role of doulas across the lifespan of, the pregnancy, right? So from planning to be pregnant or learning that you're pregnant to birth to postpartum to, whatever the birth outcomes are, managing that.
Mhm.
Um, the role of doulas has spiked for Black women.
Mhm.
Yes.
And I want us to pause and talk about that, right? Because it is a community response. Being a doula and seeing this sort of rise in doulas, and like you said, they've always been around, midwives have been around, but the rise in doulas since the news alerts, right, of Black
Mhm.
maternal disparity
Mhm.
has become very commonplace. Like a lot of people know about it. We've also seen a rise in response from the community through being a doula. So,
Mhm.
can you tell us about what that community is like? Like, what is it like to be a doula and to respond to the crisis with the kind of care that you have to give?
Well, let's talk about the crisis.
Mm-hmm.
And I have facts. Um, Black women, and I'm in Georgia. I'm going to talk about Georgia right now. Black women in Georgia experience a high mortality rate during childbirth and pregnancy. They're 3 to 4 times more likely to die. To die
Mm-hmm.
because they're not monitored as carefully as white women are.
Yep.
Because their symptoms are often dismissed, which we hear a lot about. We've been hearing stories, I feel this or this is going on. It's dismissed. Um,
Mhm.
Black women face a disproportionately high risk of maternal mortality and morbidity compared to white women, and the rates I think are 2.6 times higher.
Mm.
And I talked about, the systemic racism being a factor, the socioeconomic position, the access to quality health care. Um, Morbidity complications have been a number one reason why I think a lot of women, they're afraid. They're afraid to go now.
Mm-hmm.
Just say
Mm-hmm.
that. They're very afraid.
I was. I
Eyes
don't
are
know
so-
about y'all.
they're
And
afraid.
yeah,
Um,
agreed.
we have, I mean, Rochelle, you've know, I know I've talked to you. I know your story, the complications of, preeclampsia,
Mhm.
hemorrhaging, blood clots, low birth weight for your child. The list goes on and on. But the issue is the stress and the trauma that us Black women have to endure as Black women.
Mm.
That stress and trauma causes health issues. And I believe that we do not see how it is impacting us until we become mothers.
Mm-hmm.
Right.
Until we become mothers.
Right. Let's put a pin in that real quick.
Yeah. I did share my screen, and there was a
We can't
ABC.
see it. Can you share it again? Sorry.
No, I think it's on. I don't know if we can see it. Oh, okay, there we
Oh,
go.
There
yes.
we go.
Okay. Yeah. Yeah.
2/3 of the U.S. pregnancy-related deaths occur during the postpartum period. So I think there may be a misconception about when these complications happen and when the highest risk of death occurs, but it's usually after delivery or right there in that window. So if you see,
Yes.
it's between 1 to 6 days is 12%. 7 to 42 days postpartum, 23%, and then 43 to 365 days postpartum, 30%. So I want to just emphasize that, obviously there are times prior to delivery where death can occur, and we have to just, like you said, that attention to detail, really looking at or listening to Black women. Like most of the time, you know your body,
Yeah.
if there's a change, and that's with any patient, right? You're supposed. That's why you take a history. You engage individuals in conversation because they live with themselves every day. You're seeing them for a shot in time. And so when you said you had ambitions to be a nurse, I am a nurse, and I really appreciate that camaraderie that I and other colleagues have with doulas
Yeah.
in their role, because it's very important. You usually establish such a rapport with patients that just go beyond that time in care that, as a provider, you only get those 30 minutes or those 40
Yes.
minutes.
Absolutely.
But the doula or the birth worker usually have that ongoing relationship. You might be talking to them at 2 o'clock in the morning, during those times where it's really critical to have those moments of information from them that we don't always capture in that little small window of the visit. So I'm grateful that, you listen to your heart about how to move forward. And I want to really quickly touch on the spiritual health, because I don't think we talk about it enough. And I'll give you a quick story. We debrief on a project that I work on, a research study. And I'd never heard this before. And I think we're going to actually write it up as a case study. But one of our, we call them perinatal nurse navigators. And they operate as doulas. A lot of them have had additional training in lactation consulting, but like you, their passion was driven more around their experience, their birthing experience. So here in Georgia, I'm in Georgia too. So at Morehouse School of Medicine, they have a certificate program to get people trained in what we call navigators, but a lot of it is doula and all of that combined. One of our navigators mentioned that in a birthing experience, one of the young ladies actually altered personality came out. I never heard that before. Their alternative personality came out. She said the voice changed. That alternative personality was really aggressive, had more of a masculine display. And I just thought that was very intriguing, because I don't think we really touch on the spiritual aspects as much as we should. It's all physical, physical, physical. But that spiritual part, that mental health element is so important. And I thought I said, and this is I'm speculating now, but I was thinking, as traumatic as birthing can be for some people, that probably made her disassociate and bring in a personality that was stronger in order to endure the experience. So I just wanted to kind of touch on that, get your opinion.
Yes.
I thought it was like really intriguing to hear that, because I haven't heard, I'm sure it's happened before, but I haven't heard anyone say it. And she was like, yeah, it came out very aggressive. So anyway, wanted to get your opinion about it.
That is, yes, Debbie, go ahead.
Um, I don't have an opinion actually.
Okay.
I feel like no, because I've seen a lot. So when I hear experiences, I'm like an open vessel, and I'm like, that's what that person had to experience, and I just let it flow. And I think that's one of the important works of a doula. And people say doula, tomato, tomato. You know,
Right. Right.
I am really we're non-judgmental.
Mhm.
We are a safe space because the woman has enough to deal with, you know, a child, focusing on birthing a child, taking care of a child or children,
Mhm.
is a lot. So our duty is to be there as an anchor, as a support system,
Mhm.
so they can have a place to say, "Oh, I can just rest. My care is on this person." And it can be a lot. You definitely have to be a strong person because I'm an empathetic person, a sympathetic. I feel all of that.
Yep.
So, you know, if someone chooses to do that, show up in that way,
Mhm.
I'm very open, and you know, I just sit, watch. If it's
Mhm.
not harming the patient, because I'm all, you know, my thing is I pray over all my clients. I pray
Mm,
before I even get a client. God
mm,
sent me the client. I pray over them, and I know that that person is covered. I'm covered. I rebuke anything. I let them be. I let them go through their moments. I let them do what I'm there to support them. If they need me to assist in whatever's going on, tell me, what do you want me to do? I'm at your beck and call. Like,
mhm.
that's kind of my thing, you know, as long as it's going to produce a sense of just rest and showing up as yourself and just
Mhm.
relax and just that's what I want, because that's what it's supposed to be, a safe haven. Like and that's just how I do mine now. Doulas are supposed to do that. You're supposed to be there to support,
Mhm.
encourage, advocate, help your patient advocate, because you want them to use your voice. um Provide resources, and also support the family as well. I do sibling doula as well. I mean, you know, it goes on and on. I was able to do sibling doula while I was in Pennsylvania, living there for a client, and I did it for their 3 kids.
Mhm.
I was with them for a long time, and it was a beautiful experience. Postpartum and sibling with their kids. So I've learned that my purpose is to be their purpose at the time, at that point of time in their life, is to be
Mhm.
someone that they can depend on,
Yeah.
in whatever manner that looks like. Um, and I do enjoy it. Um, my goal is to end up in the prisons. Man,
Mm,
that's my goal. It's so hard to get into that community. But my goal is to really support women who are with child in
Mhm.
the prison and in halfway homes.
Mhm.
We forget about that community,
Yeah.
and they need to do. They need
yeah.
assistance.
And I think what you're saying is like Black women, impoverished women, as you just brought up, imprisoned women, um, need to be treated as human. And
Mm.
I think the maternal health crisis is unfortunately a very glaring example
Hmm.
of what it means to create hierarchy among human beings
Yeah.
from the moment of birth. So even the carrier of these type of children
Yeah.
are put in a position that's lower
Hmm.
than the carriers of other kinds of children,
Mhm.
right? And so it's just it takes us all the way back to
Hmm.
the foundation of the US and the way that Black women were treated as cattle, and right, and even worse than cattle in some ways. And that legacy of dehumanization and mistreatment is showing up every day.
Yeah.
My own experiences, and we all have unfortunately, birth is traumatic. And, people hear you say that a pregnancy, being a mother, the start of it is quite traumatic. And yet we're supposed to smile through it, right? The
Mhm.
baby showers and the all of that. I mean, my last child, my own experience was so difficult that even hearing about somebody's
Yeah.
pregnancy would make me nervous
Yeah.
Right.
Yeah. Yeah.
and saying, "Oh God, I hope they're okay."
Can I do that?
Yes, and I'm almost like superstitious now with baby showers. Like I don't want to go.
Mm.
Mm.
I had to change the date. And I'm even being able to say this without tears is she's going to be 7. And
Yeah.
I literally just got over the hump of breaking down. But when talking about this, right? Um, but having to change the date of the baby shower when I went into, they had to take her early and she was premature,
Yeah.
almost 7 weeks,
Hmm.
not knowing if I was going to survive, if she was going to survive. Um, so those type of things are now reminders of
Mm-hmm.
what the trauma was like and what
Yeah.
it still feels like. It still lives within our body. It's still
Yeah.
like I can still feel physiological
Mm.
reactions
Mm-hmm.
to this whole conversation. My back hurts, right? Because of just what it was like. And yet, thank God, I get to see my children and celebrate them.
Yeah.
But loss is still there, right? And we don't get to talk about the loss in terms of the idea of
Yeah.
what
Yeah.
pregnancy and childbirth was
Yes.
was what was it sold to us,
Mm-hmm.
right? Trauma was not sold to us. The,
No.
the baby showers and the beauty was sold to us.
Mm-hmm.
But what you have to go through before you get to the other side, some of us don't live to see it. And some of
Mm-hmm.
us are scarred on the other
Yes.
side and don't get a chance to discuss what that scarring like. And I tell people like, scar tissue, you get a C-section, I've had 3, it's
Mhm.
internal. You can't see that scar tissue.
Mm-hmm.
And it's the same way with emotional scarring and
Yes.
psychological
Yes.
scarring, right? You don't see it. You just see mamas, black moms will dress their babies up. Everybody look good, right?
Oh
It don't
yeah.
matter how much money we got. We are going
Hmm.
to make sure our babies look great and we're all ready and picture ready. But
Yeah.
you don't see those scars, neither the physical nor the mental, neither the spiritual. Because
Yeah.
I tell you, the spiritual part is when you feel like you're lost, and maybe you have lost, however the loss has happened. It makes you question whatever faith you had,
Yeah. Yeah.
and there's not a lot of room for that questioning.
Yes. Yes.
You're shamed even for that, right?
Yes.
So as much as we know the stats of, what is the disparity like,
Mm-hmm.
I think what is sometimes missing from the conversation is what does it feel like to bear the brunt of this disparity as
Mhm.
Black women walking through the world, walking through this country, knowing that when you go into a doctor's office, you have to be over prepared. You have to present yourself with so much, awareness and ability to navigate and advocate for yourself. And the last thing I'll say, as wanting to hear y'all thoughts too, is the idea of self advocacy makes me feel I'm very conflicted about it.
Yeah.
Because when you are sick and when you are in need of care,
Mm-hmm.
At your most vulnerable time.
Yeah.
and to expect somebody to
Yep.
advocate for themselves at that moment
Yeah.
Yeah.
is so unfair. It's so unfair. It's just
Mm-hmm.
as dehumanization. And I've been told this. Well, why didn't you speak up? Why
And
didn't
you
you
have your
say?
list of things to
And let
ask.
me tell you, all the swear words is right here. Okay? I'm ready to cuss everybody out. Because
Yeah.
I'm like, are you serious? When I'm at my weakest, you want me to
Yeah.
advocate for
You
myself?
can't even.
No. And that's why I really appreciate,
Yeah.
the presence of doulas and midwives and those who can have more time, and their whole sort of position is about support and care,
Yeah.
right? Because it's just not fair to expect people to advocate when they're at their lowest in many ways.
Hmm.
And you brought up something about advocating. And that's why a lot of my I teach a lot about empowering. If someone wants to work with me, I really would like to get them during their prenatal.
Mm-hmm.
because it's a lot of education, teaching them about their birth plan. What do they want it to look like? What do they, what do they want? Who do they want in a hospital with them? Do you have a partner who's supportive? I get to find out a little bit more about them and kind of try to empower them so they can make decisions, right now, and know if there needs to be a shift, start to get their mental state right where, if it goes this way, this is what can happen. This is what, it's important to really empower women earlier on in their journey of motherhood. And I was on both sides, in the beginning, when I had my first child, I wasn't empowered and I was, very out of it. I didn't know what I was saying. I don't know what I was supposed to ask. I was just laying there like,
Yeah.
my mom was there with me and my sister, and then my partner at the time. Fast forward when I got married, and I felt, and you would think I would be all empowered because I'm a doula, but you're a mother, Rochelle. Like you're saying, you're in that moment. It's still you're strong, things, but your mental state, physical state, all of that is being pouring into that child now, trying
That's
to
right.
out of the womb. That's the focus, right?
Right.
And I had to even pivot because I wanted a home birth. I wanted this back to Eden home birth. Man,
in the water.
Yeah.
and I didn't get it for any three of my kids. That's something that
It's heartbreaking.
it's heartbreaking. It was heartbreaking because I'm like, wow, I can do this for others. Why can't I do it for me? But I had to realize, I am high risk. I was born with a septum in my uterus. I would have never known that if I didn't become pregnant. Like a septum, I'm very high risk because of that. And for me, it's just not the safe route to have a child at home.
Right.
I was with my first child, Rochelle. They had a baby shower where I was in a hospital.
I remember that. That's so. Oh my goodness! Now that you just said it, it's just.
So, all of these things that women have, like this whole grand scheme of how pregnancy will be, it's important to let them know. I let them know, listen, as long as the baby arrives safe and you're healthy,
Right.
that is the goal.
That is so
Because
true.
I never want them to feel
Yeah.
they are fair, like they did a bad job.
Yeah.
We need to get the baby here, and we need you to be here.
And we need to make sure you survive.
And we need to. That's the goal, because it can shift. It's my second child, I had an emergency C-section. I didn't want a C-section.
Yeah.
Nah, man. What?
The worst. I mean, I'm grateful.
I'm grateful, but that's not what I want.
That wasn't the plan, right? Your birth plan and what reality was they didn't match in that instance.
It didn't match. My third child, my third and last of the Mohicans, I said, God, I want to do this natural. I want to push him out. And obviously, they tell you when you have a C-section, you should have another C-section.
Right.
Complications. And part of me wanted to experience what my clients were experiencing. I wanted to feel it. I wanted to go through the natural birth. I wanted to see how that felt. I didn't experience my first child. I was like, give me the epidural. No shame here. Whatever. The second one, emergency C-section. It is what it is. And I did it. I had a VBAC. And
yeah, VBAC. Okay.
I sure did.
I wonder.
And I was like, wow, now I know how it feels. Now I can sit with a client who's going through it and be like, I know how you feel, girl. But I feel to have a C-section.
I am. I'm unapologetically C-section person. I had a few of those, but they didn't even want me to have contractions because I had a myomectomy.
Okay.
They didn't want my uterus to rupture, so I was like,
you have to take.
But I do understand. My first child, he came 4 weeks early. Yeah, so he did the NICU for a week for a month. So that was.
How was that?
I mean, I went every day, so obviously that took a toll because I couldn't really recover because I was so into making sure he was good. And he was fine. He was breathing on his own and all that. He just was a boy and would not and kept kind of aspirating when he was trying to eat.
Yeah.
And so that was scary the first couple of days. And like you said, when it doesn't matter what profession you're in that moment you're a mom and you're vulnerable, and you should be able to be without
Yeah.
anyone being judgmental about you
Yeah.
having care at that moment in time and not having your professional hat on as
Yes.
a provider, because that's not the role you're in the moment.
Mhm.
And I just feel like we should be able to be vulnerable in those times when we need help and
Mhm.
we're not the helper,
Mm,
because
mm.
we're the helper probably about 90 to 95% of our lives.
Mm.
Yes.
And for the
Yes.
5% when we need to be vulnerable and be helped, we shouldn't feel guilty about that. And so I appreciate the doula role because you reaffirm women in saying that it's okay
Yes.
to be
So,
vulnerable. It's okay not to be the one in charge and running things at the moment. Like, I'm at your beck and call. You be who you need to be right now. And that if you need to cry, if you need to
Yeah.
laugh, if you need, me to help you with pain or
mhm.
breathing, like I'm here to be that for you. So,
And that can last for a long time. Rochelle, you said something about, your 7-year-old
mhm,
Mhm. She's 6 and
and
a yeah.
still feeling
Yeah.
the effects. And postpartum does not, I always say the fourth trimester does not have an expiration date. It does.
Mhm.
I still feel the effects of my 21-year-old.
Yeah.
I
mm,
still feel things.
Yep.
I still
so
do.
that birth.
Well,
So
you know that there's science that tells us that every time we have a child, the mom's brain changes,
yeah.
right? So
Mhm,
you talk about the changes in your body and your brain, but also the spiritual changes,
Yeah.
right? And
mhm.
so those emotional connections and bonds,
Mm-hmm.
yeah, I mean it's with us,
Those,
women,
yeah.
mothers feel it.
Debbie, I have a question because I've seen this happening quite often on a personal level, like from my
Okay.
own family, but also through some of the women we work with. But seeing a lot of younger people getting right back pregnant, like literally prior to their postpartum visit. They had like 3, 4 kids already, and then they're. I mean, this is happening a lot with our debriefs, and I have a couple family members who have children in that order, like 4 kids
Yeah.
under 3. How do you see um, in your experience, what about those instances gives that mother time to recover? How do you help them kind of, since we know that they're still feeling the impact of child 3, 4,
Yeah.
5, and then they're about to birth 6. So any tips or talking points on that matter?
Yes. And I talk about reproductive rights a lot because
Mm,
that's something that's being taken away from us
Mm-hmm.
um, by I'm trying to say it in a great way, in a good way, by someone who does not have a womb.
Right.
Um, don't make laws up for women if you're not a woman.
right.
But a lot of, I don't want to get personal, but I'll talk about myself.
Okay.
I could have been her.
Okay.
Mm.
Okay.
I could
Okay.
have been her.
Fair. Fair.
I could have had a child right after my folks. I could have seen myself. I was actually going towards that route.
Mhm.
Um, so prayer is really important in the practice that I do. I'm telling you because I see there's a lot of battle with self love.
Mm-hmm.
A lot of these women, acceptance. Um,
Mm,
there's a lot of just generational trauma
mm,
and things that are being repeated
mhm,
that seems normal, right? This is just how it should be. My mom did it, my aunt did it, we all got kids. So I really try to get to know the person
Mhm.
and make it more of like a sister bond. Like, girl,
Mm.
um, let's talk about, where's the, where's is the father coming back into play? Like,
Right.
what, I just really try to have a nurturing spirit. Like, I talk to them like sisters because they don't, what I see is they don't have that love, that real genuine love, people who really care for them.
Mhm.
Yeah.
And they're making decisions. Um, some of them are making decisions based off of fear,
Mhm.
stay in relationships. So that's another issue.
Yeah.
Yep.
And Rochelle, you do research on those type of relationships. There's a lot of abuse there, mental, emotional
Yes.
abuse,
Yep.
not having or seeing a way out, but just seeing as a doormat, kind of. I'm just here to just conceive and pop out. So there's
Right.
that aspect. There's also the aspect of financial stability. I can't take care of myself. I can't take care of the kids. I'm going to depend on someone. So even though there's not a great relationship, and I'm just going to have kids, but also I've seen people take advantage of the system
Right.
and
Right.
keep having kids because of this,
Um,
because of the system,
that's a good point.
because of the system.
But now that the system is taking
Oh,
a huge
Oh, it's going to be a
change,
different story.
I'm very afraid
Yeah.
for them.
Well, I'm afraid for them too, but
yeah.
this is when you got to put your big girl's panties on.
Mhm.
Because I was a product of this. I used the system for when
Yeah,
I needed it, because I
absolutely.
needed it.
That's right.
Right? I
Right.
knew that I wasn't going to stay on the system because it wasn't going to get me to where I needed to be in life.
Mhm.
Um, so the system should be there to help individuals. But if there's people abusing it, I say it in love that you know what they have training. They have a lot of things you can do to get out of the system. Okay,
Yeah.
the system has things in place to get out of the system. Let's
Mhm.
take advantage of that. Let's see why you're thinking this way. Let's navigate. I try to really get into their mental space to see why they're making these choices. Who is around them?
Yeah.
Their friends, their family. What are they seeing that to
Yeah.
them looks like, oh, this is how it's supposed to be?
Mhm.
Hmm.
Because maybe to them, this is how it's supposed to be.
That's right.
Our
That's
norm.
right.
It
And
ain't
a lot of them, sorry to cut you, but a lot of them are coming from one generation before our grandmothers were having 8 to 14
True.
kids,
There you
True.
go.
That's
That's
right?
true.
And
true. Yeah.
so it's not that far removed
No.
from them
It's
to
not.
have all these kids. It's kind of newer that, Black families are down to two,
Down to the two.
Yeah. And
Right.
also, a
right?
lot of them are raising their siblings. So
Yeah,
that's
Right.
they're
another
used
part
to
of this.
seeing that. They're used to like seeing a whole big old family, and I love when you talk about the self love, the
Self-love.
aspirations, the belief systems. I think because I don't know if people really think of it like I don't love myself. I think it's just like
What?
when we ask people what do you believe
Yeah.
that leads to a certain behavior,
Mhm.
they'll just tell you like, well, this is what I thought was normal,
Or
and
what is your goal in life?
right.
Your
So
goal in
they
life
might
may not be.
exactly they might see, Auntie Debbie doing something different or Auntie Rasheeta doing something different, but the norm around them is still very much, just
Just
produced.
that.
And then like you said, like if it's about staying in that relationship, I mean, we know wealthy people that do that. You know what I'm
Well,
saying?
that's true. That I
you
mean,
know?
and I do want to be very clear that some behaviors, some traumas, different things that we're talking about does not necessarily have just it's not only in people who don't have means.
That's right.
Yes,
Like you
that's
said, it's
true.
across the
That's
economic
across the
That's
board.
spectrum.
right.
So we want to be very clear
That's
that
right. That's
we're
right.
not trying to
Yeah.
label
Reproductive
anyone.
coercion,
Particular.
for instance,
Yes. Mhm.
having a child getting pregnant due to manipulation and
Yeah,
fear or
true.
retaliation of your partner, does not have an economic stamp. That is
No.
across the board.
Yes, that's
And
across
it's
the
not
board.
talked about. I mean, we'll definitely, Debbie, you got to come on again and we talk about that specifically.
Absolutely.
But I think we do see it maybe over representation of that sort of situation
Yeah.
Yes.
among those who fall into lower economic statuses. And so there's an extra risk, right? There's a risk of not knowing the resources to get from, you know, to move beyond dependency on the system. Like just that awareness, I think, is a big part of it. And I, you know, piggybacking off of Rasheeta's question, how do you, when you as a doula, because you talk about not having the judgment, you come in as an open vessel, you being with them wherever they are you able to encourage people to make healthier decisions when it comes to the next pregnancy or relationship stuff? Like, what do you find are your limitations when it comes to this sort of conversation?
Yes, I have, and it's the most beautiful thing. The main thing is that I have to really be intentional about staying in contact with these women, even past the period where I'm supposed to be. Like I find that I just go way over and beyond, but that's because I wanted to see them to win. So I make sure, you know, during my last consultation or whatever, I normally, not consultation, my last checkup or appointment with them, I normally leave them with resources. Resources of, you know, whatever they're going through and they're trying to get out of, or I know they need to get out, they have those resources, but I'll also check up on them. You know, it could be months at a time, weeks or whatever, depending on the situation, and just I'm in their ear like, hey, did you call so and so? How's this going? Or are you so and so? Did you go counseling? Did you go therapy? Because I really, and I've seen a few of them come out of that, what you're saying, Rasheeta, of that they stop it, you know, or they literally have even changed the way their kids behave by changing how they behave, like they're getting help with themselves.
Yeah.
Even steps with just getting therapy. I've seen people do that. I've seen them get jobs. I've seen people leave relationships, which is so hard to do, and moving with parents, which is hard to do. But it saved them from a life full of miserable and just,
Absolutely.
I mean, I've seen them get their power back, is what I'm saying. I've seen women get their power back. I have seen women who have not, who choose to make excuses, who choose to try to suck more information out of me, but not make changes. You know,
Right.
you know, I've seen that behavior as well, and that, you know, at that point, you know, there's only so much I can do. But yeah, my whole thing is support. I just try to support as much as I can. I support as much as I can, and resources. They need the resources to make the pivot.
Well, I appreciate the point made about where we are generationally, and I'm only 2 generations removed from where my grandmother, was it one, had 17 children. But, you know, but my thing about that, and I think we touched on it, was about, okay, well, what is your goal? What is it? My grandmother knew what her goal was, which was to survive in that time. And so she got married at 14. She had 17 kids. They worked in different capacities to ensure survival, right? So I agree. I think having a goal and kind of having women think about what that is, because sometimes, depending on, you know, when they start having children, if they're younger, they may not have thought about, you know, what is it that I want to accomplish you know, beyond this, and having children does not have to stop you from achieving that.
Exactly.
And how can we still move you toward what it is you would like to accomplish? Because trust me, you know, throughout my family, I have young women who have had children and had to still navigate
Yes.
and push through to get to their ultimate goals. But I think maybe having a goal in mind is very, very helpful to seeing, okay, this doesn't have to stop me. I can still work toward that goal. And then secondly, I did also want to ask Debbie, because we talked about partners and we talked about support systems, where how do you engage those individuals, and do you get the permission of that mother in order to, or get a request from the mother to also include their support system in your process?
Yeah, so I normally ask.
Hmm.
I normally ask ahead of time, do you have a partner? I don't want to ever assume.
Sure.
Um, and just recently, I had a situation where there was a couple. I didn't know that it was the same sex.
Mm.
Um,
Okay.
hey, whatever floats your boat.
Hmm.
I'll make sure the child gets here. I'll make sure the child is healthy. But at the same time, I wrestled with the postpartum part because I thought, what is the child now seeing as
Hmm.
normal? And then I was like, that is not for you to carry. So there is some
There's some personal things we have
some
to
things, yeah,
have.
because of the way the world is going. And I try not to overstep my boundaries, but I
Mhm.
normally ask. The last birth I was at, unfortunately, she did not want the partner to be there.
Mm.
But the partner's still in her life. you know, I don't really push it,
Mhm.
not unless it's given to me. But if I
Mm-hmm.
sense there is something, which normally I do, then I'll go a little deeper just
Mhm.
to make sure a person is safe.
Mm-hmm.
But yeah,
Okay.
normally I ask, and I've had clients who've had their partners involved more than during the postpartum. Very, very, very helpful with,
Mm.
making the food, going grocery shopping. I had some women at the birth cussing out their partners, and the partner's sitting there laughing. And I'm like, all right, well, you should just go out the room because she does not like that you're laughing right now. Let me have some time with her.
Mhm.
They're not like, they're like just, they're like mad, and they're like, get him out. And I'm like, okay, let me get some. So I've had so many different
You
dynamics.
add a different, a
Oh
good
man,
little different flavor.
Every listen, I'm sure you've seen a lot, and I think for it's helping families communicate support is
yeah.
a big part of what we're doing, right? And
Mhm.
so, what are some of the top things you would tell the extended family, like the moms, the aunties, the fathers, the siblings of the birth, right? The person who is carrying, and because I think a lot of the shame and embarrassment and frustration is is related, is somewhere in like it's close by. So as
Mhm.
much as we're looking at disparities and the structural racism and stuff like that, that is, we have to deal with that, right? And we need legislation, we need the mommy bus, we need, which, there's things that are out there that are trying to undo the harm of many, 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 many
Yeah.
years,
Mhm.
right? On a community level, right?
Mhm.
When we say we got to do good by each other, the role of the doula feels like it could be educational for the family, right? And you talked earlier about helping the siblings,
Mhm.
so what would you tell families? I know one thing I would say from my own experience is don't comment on the weight, height of the baby, because I've seen, and I know we do this, right? But it indicates health, right? So that means if the baby is 8 pounds, you're like, ooh, that's a big old healthy baby, right? But my 4 pounder was healthy in her way. And
Yes.
I remember, not because she came out, didn't breathe on her. I mean, she breathed on her own. She was miraculous, really, because they didn't expect anything like that.
Yeah.
But I remember not feeling comfortable
Mhm.
announcing
Mhm.
her birth because I didn't want comments on the
On her.
weight of my baby.
Mhm.
I was so grateful that she was alive. I didn't want
Yes.
anything to
Yes.
take that gratitude from me. I didn't want to be caught up in other people's perception of
Perception.
what health looked like.
Mhm.
And so from my own experience, I mean, it could be trivial, something to get over. But I also wonder, how can we help families be more supportive, be a place that feels safer
Yeah.
for moms to come home, because I think we talked a lot about this postpartum period,
Mm-hmm.
and Rasheeta brought up the stats, right? That is a critical period. So
Mm-hmm.
if we are bombarding folks who just had a baby
Yeah.
with our own preconceived ideas of what that means and what it should look like, we could be missing health cues that could save their lives.
Mm-hmm.
Right? I almost died within the 72 hours after giving birth. That's when I was most
Mm.
sick. Right? Even I was very, I was, I can't say most sick, but that's when I needed blood transfusion. We had to do a scan for a stroke. It was mayhem, right? After the baby came out. And if you are a person who dealt with severe preeclampsia or HELPS, what's supposed to help you is giving birth.
Yeah.
That was not my case. I actually got worse.
Yeah.
Yeah.
So I just think about, who was all in the room. I didn't want to see a lot of people because I could
Mm-hmm.
already
Mm-hmm.
anticipate what
Mm-hmm.
people would come in and say.
Mm-hmm.
But, I've heard doulas communicate such love and support and care, so tell us, what do we need to say to folks after they have the baby, that postpartum period? How can we be more supportive?
Um, so if I may, Rochelle, there's a couple of things that people need to be mindful of saying before, if I can just touch on that.
Yes, absolutely. Yeah.
Being very mindful of saying, when are you going to get pregnant? Why do you have
Oh,
to do that?
Oh,
That is no, because
Oh,
I
very
experienced that. Oh,
well,
Lord.
because there's a lot of people who are literally trying and have losses, miscarriages,
yes, that's right.
fertility issues, or has some traumatic issues when it relates to intimacy, right?
Yeah.
That is touchy. So people need to mind their business when it comes to someone wanting to conceive. Like, don't ask when the baby coming, when you gonna get pregnant. Please don't do that. That has become very, very touchy for some people.
Mm.
It's just, you shouldn't do it. It- just stop, please. Um,
Amen.
when no, seriously,
Seriously.
when women are pregnant, don't just assume you can touch their bellies. I've heard about
Mm.
this so many times, even from family members. Do
Yeah.
not assume that because the belly is there showing that you can just rub up on it.
Mm-hmm.
Number one, I don't know what type of energy and spirits you come in with. Number
Mm-hmm.
one. Number two, this is my personal space. Respect.
Amen. Yes.
People are just assuming they can just do whatever.
That's right.
You
That's right.
cannot assume.
Mm-hmm.
To postpartum, girl, I can go down the list. Um, woo! We have to be very mindful, the community, of respecting the boundaries, but also be mindful that we do need help
Mm-hmm.
at the
Yeah.
same time,
Yeah.
and don't take anything personal.
Mm-hmm.
Don't. It's not about you right now.
Exactly.
I don't have the energy to ask for food every day,
Mm-hmm.
get groceries every day. I'm trying to take a shower. It's been a third day and I haven't taken a shower
Right.
yet. So listen, pick up the phone, tell me when you're coming over.
Mm-hmm.
If we have that relationship, and you know we have that relationship,
Mm-hmm.
come on over. Come do my laundry.
Yeah. I would
A lot
welcome
of us just need
a
to just
meal.
take the initiative and do it, and don't
Yeah.
have to ask,
Yes.
please, because it's not going to happen.
Right. Because I'm living off of 2 hours of sleep. If
Okay.
that, right? Like,
Okay.
I am not thinking about it's a moment to moment. Oh, yes, for sure.
If you know, Rochelle, I don't know what happened. If you know, just if you know we have that relationship, you know what you can do. You know you're welcome.
Mhm.
Come on over and help. Come watch the come. If I have other kids that are small,
Oh, yeah.
please take them.
Hmm.
If you know we have that bond,
Yeah. Give me that
pack them
time.
up. The
Hmm.
older siblings, as a doula, And this is just things that I do as a doula. I come in, I make meals.
Mm-hmm.
Um, the older siblings, if they are able to help, they
Mm-hmm.
are helping. They are
Yeah.
helping. They are helping. They are, in whatever capacity that needs to be helped. The partner is there. He is helping. Everybody's helping out. Everybody's doing something. Mommy got to chill and relax.
Mm-hmm.
Mommy needs to rest. And mommy doesn't need to be asked. Mommy doesn't need to ask for help.
Exactly.
It's a given. So show up and support. Doula show up and support. The doula sometimes have to initiate that support from the community too, and ask the community to
Come on,
support, to
step
help.
it up. Step it up.
Yeah, Rochelle, we can't hear you.
Oh, this used to happen. The
Yeah.
support was a given, right? And I think, our grandmothers and great grandmothers' generation, as traumatic as it was in different ways,
Mm-hmm.
because I mean, you're talking about trying to have black babies in the 30s and
Come
40s and
on.
50s. I mean, the hospitals could not care less, right? Doctors, and so like giving
They were
context.
helping each other. They were birthing,
That's
helping.
right,
They were
because
birth
they
workers for
knew.
their sisters.
That's
My
right.
grandmother.
That's
Yeah.
exactly right, because they knew that there was no reproductive justice in the system.
Yes, yes,
And
Mm-hmm.
so we need to get back to that. And I know doulas are really helping us to get back to that, is that we have to take care of each other,
yes.
because
Have to.
this out here, I've been in these hospitals, private, public, the bottom of the hospital, because, coming back to the States with no insurance and having to face what it looks like to be a
Yeah.
Oh wow.
pregnant person with no insurance.
Insurance. Yes.
Dealt with like a lab rat. Okay, I
Yes.
had to ask them to cut me on my leg before they started this cesarean, because I did not believe that my epidural was legit.
Was work.
It was
Wow.
Really?
Yeah, because they were using students on me. That's what happens, right? And
Wow.
I get it. Students need to train too, but like,
But you should be asked. You should be asked. So that's one of my pet
So
peeves.
right, where's
Is
it?
you
Where's
should
the
be asked
consent?
permission.
That's
That is
right.
the rule of
that
thumb.
just happened to one of my clients. I was
Listen,
in there
there
and
was
they brought.
I don't recall permission, and I could have been,
Yeah, they should
I wasn't
always
investigated or
ask, can
anything. I
my
don't
student
recall
come
any
in?
question of consent. I just knew
Yeah.
that I had to advocate for myself, and
Mhm.
because I had friends who told me that the epidural didn't work, and they felt
They
everything,
felt everything. Yeah. Yeah.
right? And so I said to them, cut my leg first before you
Woo.
cut my. And
Cause
they
you
had
was
to show me on my leg that they cut me. No
That is
lie.
the ultimate mistrust. I mean, because
So
mistrust. We really mistrust.
imagine what my heart rate is doing when you have
Yes.
to do that. Imagine what my blood pressure is doing when you have to advocate for yourself. That's why I said advocacy is not necessarily the best solution here, because it has other side effects on
Mm.
the mother. When
yeah,
you're thinking about saving your own life and you're on the operating bed, like
yeah, that's not
that's not
fair.
fair, right?
Mhm.
So we got to help each other. And I just, I would say that we need to celebrate doulas, like whatever, because I know it's not necessarily always a paid thing too. You take
Mhm.
clients that
Mhm.
can't pay. I know a lot of doulas, that be
Mhm.
included, who help anybody.
Mhm.
And so there needs to be funds that are funneled to these folks who sacrifice to be community, to be support, to be mommy, partner, all the things to pregnant Black women. Because it's really dire out here. I think because we hear the stats so much over and over again, people recite it, oh, we're 2 to 3 more times likely to die. And it's like, do y'all know what y'all
You're
saying?
right. Do
You
you know what that
understand what
means?
that looks like in real
Right.
life? That
Mhm.
means that as a Black mother, when I go to my OB, I'm looking at them like, y'all not about to kill me, are you?
Right. Right.
Real
I know.
real talk.
I know.
Oh, I advocate for my clients so much. Sometimes I talk too much, I think, and because I really want them to use their voice, but I feel like sometimes they're being taken advantage of. And
Mhm.
I had to do something the other day, and I'm glad I stood up for her. She was being rushed into postpartum,
Mm.
and all she wanted to do was hold her baby one, like just hold her baby. And she was being told, well, the baby's right here in the crib next to you. The baby's going up with you to to postpartum. You're going to see him. It's okay. Like, we got to get you up there. And I just saw her face, like,
Can I just touch him?
just,
Goodness.
she just had, you know what? There were students in there, Rochelle. There was two students in there, and there was a nurse. And I said, please, can you? She just wants to hold. I took the baby out and gave it to her. I said, just give us a moment. Just want to hold her baby. Just things like that really just.
It's so medicalized.
It's
Yeah.
so
Part of it starts to get sucked out of it, right? It's just like bam, bam, bam. We got to get you here, got you. But the beautiful parts of it is those moments, just like what you did to just give her that moment. Like it
Yes.
took what, a half a second, 1 minute. Just
All she
I just
needed.
want to touch him.
Just
I just want to see him. Let me look in his eyes.
yeah,
I mean,
and she took more than a minute, girl. She took like 5 minutes.
good for her. I
Listen,
mean,
I wanted all the time with my
all
baby.
the time, and they stood there and waited.
Yeah.
Here's the thing. We know now that skin to skin helps
Yes,
with
so
milk
important.
production.
I was gonna say that is a part of like the natural,
Yes.
birthing process. Of that.
Yes, even healing
all
for
of
the
this.
mom.
Yes.
This has been outlined in the research, so I don't understand why. And that's it. We have to have people in the room who revert back to the things that are important. That is an important thing to happen, even medically, right? Even in the process of what we want to achieve, because we want to promote breastfeeding. We want to promote those things for the baby. So we have to remember that and not always be rushing to do what's next, because it really takes away from those moments that are truly, truly important. And I am, this conversation's been just like, we could probably go another 2 hours on this process and everything that has to do with birthing, because there's so many topics that we could address that, just things have just been completely for Black women in this space. There's just so many things that need to be improved, obviously. And I want to make a point, and if no one gets anything else, I mean, there were so many nuggets here. I'm sure you will enjoy this from the moment we started. But if students are involved in care, and like you said, at teaching hospitals, that's not uncommon. We're always vying for clinical spots for nurses to get that training, but they are to ask patients for their permission. When I have students precepting with me, I always, prior to them going in, go in first and say, I have a student with me. Is it okay for them to come in? That patient has to say yes.
Yes.
They say no, then the student cannot go in, and they certainly cannot provide care.
Yes.
So you do have a right to reject having a student. So I just want to put that out there.
Thank you. And I would, as we end and wrap up, I think there's a couple of things, we always talk about what's hopeful, right? And this particular topic is very depressing. Like, if we were to run off all the numbers per state, per county, per all that, it's very scary. But I think there is still a lot of hope out there. I would even say that I've seen providers become more compassionate in their communication. Not all, by any means, but I've witnessed some, because they know the scrutiny is real. They know that people are watching and paying attention. And so that's a good thing. I think the pressure is on to let providers know, listen, this is a very serious situation. Microaggression, that's, it's a harmful thing, right? To assume that a Black mother is irresponsible when she comes in as a pregnant person, right? There's so many subtleties in terms of how mistreated we are every time we go to see a provider. But I think some are trying to become more culturally aware, more aware of their own biases. And I really think a lot of that has to do with doula work and other kinds of patient-centered care. So I'm grateful for that. That gives me a lot of hope. I think the presence of doulas gives me hope. Um, I don't know if all people can have a doula with them, right? But if we would, but the ones that do and the ones that you do get to serve and support, Debbie, I think are better for it. And so you give me a lot of hope with the work that you do. And I just want to give some space for both you and Rasheeta to talk about, when it comes to this topic and comes to this issue, what is keeping you hopeful when it's kind of, it's really tough?
I'll let Debbie go first.
When it's really tough as far as the profession.
Or just this issue, like just, knowing that so many people are not being cared for in the way that you spoke about earlier. Like the comprehensive care is not happening. The pre, post, during, there's no care. But, what is giving you hope to continue?
I think for me, what gives me hope is that I'm a solution to the problem. I'm doing something about it. And that really gives me a lot of hope, because if I know it's just not me. I know there's someone else that's doing the same thing as me, and this movement is huge now. Like this birth work is huge, and just knowing that I'm doing something about it and not just sitting there complaining, and I'm actually a part of the solution. That gives me hope. If I'm part of the solution, then I know there's another Debbie somewhere or another doula somewhere that's a part of the solution. And the more and more we all just add up and it gets together, it's going to be an amazing collective effort. There's a lot of support out there. They have the National Maternal Health Hotline. Like individuals can just call and get help. They have the PSI postpartum resource line. There's so many resources now out there for postpartum, for maternal health. I see the hope. Like I see it. Now, do the individuals who need the help see it? That's the question. We have to get it to them. They may not see it, but it is there. The help is there. So yeah, that's what brings me hope, knowing that I am part of the solution and I'm doing something about it.
Awesome.
Thank you for that. I would echo. I want to point out a couple of resources. One is Black Mamas Matter Alliance. I'm sure that you have probably have encountered them. They do focus on Black mamas and maternal health and rights and justice. And so I want to just say that is available. They have a lot of resources on there. I also want to kind of shout out my comrades, my homegirl, Dr. Hernandez, who's the director of the Center for Maternal Health Equity at Morehouse School of Medicine. They have the prenatal patient navigator training program. So want to certainly kind of shout that out if you're interested in being another Debbie, making it happen, really seeing change. You can maybe pursue something that will give you the skills in order to accomplish that. So I'm going to stick that up there. And then one last thing, one of the projects that myself and Natalie have worked on is a mobile app that helps women in the postpartum period.
Yes.
So it's called PM3, and I'll put that website up as well. It is not publicly available. We just did a feasibility test with it, but we look to get it public. Awesome. Get it going out there publicly, and hopefully have birth workers using it to help their patients kind of be able to monitor some things that are impacting us. And it was unapologetically focused on Black women and some of the things that we know commonly cause death in the postpartum period. So wanted to shout that out as well. Awesome. I'm going to share that on the screen, but we will close out in that as well, so we can move forward. I don't want to keep Miss Debbie because we could talk to you and keep picking your brain. But thank you for joining us today.
Thank you for having me.
So, Rochelle, do you want to close out with some final words? Or no?
At the end of the day, she's like, oh.
I'm excited about the work that's happening, and I'm just grateful that we have scholars and scientists doing that work, research, and then we have practitioners and community workers like Debbie. I'm grateful. So, we're not alone. I think birthing feels lonely, but we're not alone. And so, reach out to different resources that you can, um, and we'll post ours as well. But I just hope that people don't feel alone, because I think that's what really kind of makes it so difficult.
Yeah.
But I'm hopeful because of the work that is being done.
Yes, yes, yes.
Right.
And Rasheeta, you probably know this, but there are some states now. I know Georgia is one that are accepting doulas. Insurance companies are paying for doula
Yes.
work.
Yes.
Mm-hmm.
That's a huge. That's huge,
That's
Yep.
right?
huge.
So
Yep.
Yeah.
that's
Yeah.
yeah. Hmm.
For sure. I was gonna kind of, I'm glad you plugged that. There are states that are
Hmm.
seeing the value of doulas, and I think it comes from the work of
Yeah.
people like you, Debbie, and others,
Mm-hmm.
just showing how valuable that you truly are to the lives of birthing persons. So we want to thank the audience for joining us today. Thank you so
Thank
much, Debbie, for joining us. You have to
you.
have us. We have to have you back.
Of course.
We'd love to also put your book in the description, so we'll get that information, because we'd love to support you and share your work. So thank you all for joining us today. We will
Thank
see you
you.
next time at Hope Health Communication. So have a great week, everyone.
Bye,
Bye bye.
Thank
everyone.
you.